Hello, ladies and gentlemen. Today is the first episode of the Health Info Africa show, this second season. We actually took a break and we are back on again. We're going to give you guys exciting and very educative sessions. Today, it happens that a lot of my co-hosts are not going to be with me, but it's not always that we're going to have everyone on board. We do have this is an online thing. Things happen. So today we are very privileged to have very educative people that are going to give us information about COVID and how it affects pregnant women. Also, we're going to take a special, interview from all the way from West Africa, Cameroon, to see what is happening in other countries in Africa as well. COVID, as we all know, has afflicted everybody around the world, not just Ghana, not just United States, not just UK. So many places have been affected. And today we're going to delve into some of the things that is going on in other countries, how people perceive the disease, as we all know that there's a lot of misinformation out there. So yes, today's session is going to be packed. It's going to be a very informative section. Please like the feed and share it. We will be giving you a lot of information. Share it so that everybody benefits from it, because the only thing we have now is to get people to educate themselves, get informed, make good decisions about COVID, and especially today's topic, which is going to be in a special group of people, which is pregnant women. How does COVID affect pregnant women? So without much ado, we're going to take a little commercial break. And when we get back, I'm going to bring on my special guest today to talk about COVID-19 in pregnancy. There's a lot that we want to delve into today. So please don't touch the dial. Like I said, make sure you share it. You share the feed. Keep sharing it. The more you share, the more we reach out to more people, and we'll be able to touch everybody as such. And of course, there's exciting news in Ghana. Those of you who are from Ghana, there's COVID-19 vaccines are available in Ghana, although it's very limited supply. It's a very good thing as we go through this mass vaccination in Ghana. So please don't touch that dial. We'll be right back after this short commercial break. All right, so welcome back to Health Info Africa show. Today, I'm just going to be your host. My other co-hosts are not able to join me today, which is we're going to have them next week. Obviously, we're going to have a packed session today. So today's conversation, like I mentioned, is going to be on COVID-19 and how it affects pregnant women. With me to discuss this topic is a very learned colleague of mine that know a lot about, health, and is going to give us a lot of information today. So without much ado, I'm going to welcome Dr. Victoria Chermantin to the show. Hi, Victoria. How are you?
I'm fine, thank you. How are you?
I'm doing great too. Welcome to HIA. We're pleased to have you today.
Thanks for having me.
Awesome. All right. So without much ado, I wanted to let you introduce yourself to our listeners. Tell us about what you do, all the great stuff that you've been doing.
So I am Dr. Victoria Chermantin. I am a junior doctor based in England. I have a background in public health and psychology and a special interest in women's health.
Awesome. Thank you for that introduction. So today's topic is about COVID-19 and pregnancy, right? This has been a hot topic. We've had a lot of questions about even how the vaccines are going to affect pregnant women. A whole lot of questions about, reproductive health and COVID-19. I mean, some of the things that I hear from Ghana about how the vaccine is going to affect people's reproductive health is just hilarious, right? So just a breaker, right? So I heard, I called back home in Ghana, and I was talking to my sister and she said, you know what the media did in Ghana? They actually told people that if you, especially the men, they didn't want to obey the rules. They didn't want to put on the mask and all of that. So the media started talking about, hey, if you men don't put on a mask and you get a COVID, your reproductive organ is going to decrease or something like that. and then everybody started wearing the mask. This is just to go to tell you how strong the media is, right? And then when the vaccine came, they switched the narrative. They're like, well, we heard that if you take the vaccine, because everybody's like, they're not going to take it. Well, if you take the vaccine, it will actually get bigger, and everybody wants to get a vaccine now. That's just by the way. But what I'm trying to tell everyone is that it's very interesting. It's that misinformation, but it actually influences a lot of people's perception. And therefore, today we have a very interesting topic about COVID-19 and pregnancy and how it's going to affect children and unborn babies and things like that. We want to find out, right? Okay. So my first question to you is, what at all does COVID-19 do to pregnant women? What is its effect on pregnant women?
So COVID-19 and pregnant women is something that is, of course, of high interest to a lot of people. Unfortunately, a lot of pregnant women have been excluded from research because they are a vulnerable population. You have a woman who's pregnant and child. So in general, most women who test positive for COVID-19 have been asymptomatic. However, for those people who do develop severe symptoms, they're more likely to develop severe symptoms when compared to their non-pregnant counterparts. So they have a 5 times chance of needing intensive care, which is what we use for organ support. If you can't breathe, if your kidneys aren't working, if your heart isn't working well, you need intensive care, which has its own set of complications. And we've seen that more women are going into preterm labor, which again has its own complications, and are needing to go for C-sections as well.
Awesome. That's so what that means is that actually pregnant women don't do very well when it comes to COVID-19 infection.
Right.
So what makes them not be able to do well? I know it's because of the pregnancy, but what are the reasons? What other deeper reasons makes it that way?
Yeah, I mean, a lot of this is unknown because this is a new virus, but we've seen it in the past with the flu vaccine or the flu, for example. Women tend to have worse outcomes. You have an increased demand on your body and on your immune system because you're dealing with 2 lives, your own life and then the life of the baby. So that has its own set of complications. Your body changes a lot in pregnancy. Your immune system changes a lot. What's required from your lungs also changes quite significantly because there's a body inside, a little baby, and it's putting pressure on your lungs. So your lungs aren't really able to expand as they usually would.
Nice. Okay. So let's think about it this way. So someone, got pregnant during COVID, right? What are some of the recommendations that you will, give to this individual who is pregnant during this pandemic?
Yeah. So if you are pregnant during the pandemic and you're dealing with what everyone else is dealing with, so the recommendations aren't significantly different than they are for the general population. We definitely want to really encourage social distancing, masking, washing your hands with water and soap or alcohol-based antibacterial gels, and definitely making sure that you have all of your vitamins. So there have been a few studies that say that if you have low vitamin D, you're more susceptible to respiratory illness. So we can't say fully that, okay, if you have low vitamin D, you're definitely going to get a bad case of COVID. But all pregnant women, regardless of COVID-19, are recommended to have 10 micrograms of vitamin D throughout their pregnancy. We definitely know that people in their 3rd trimester have worse outcomes when they have COVID-19. So definitely as you're approaching the end of your pregnancy, it's really, really important to do what you can to prevent getting the virus to begin with. But if you do contract the virus or are in close contact with someone who does, organize a rapid COVID-19 test and then be in contact with your primary healthcare provider. Because again, we know that if you get it and you have severe symptoms, they tend to be much worse than those compared to your non-pregnant counterparts. I can't hear you.
What a lot of people are going to talk about is the fact that, I mean, you're talking about the pregnant, like you said, there are two people, right? You have the baby or the fetus, and then you have the mother herself. So we want to see what are the effects on the mom and also what are the effects on the baby. Is there any correlation or anything identified so far?
Yeah, so far, babies have been okay, meaning we're not seeing a lot of increased stillbirths, we're not seeing a lot of increased miscarriages, but mom's health is definitely worsened. So that's something to really be careful of and keep in mind. So far, we're looking at things like antibodies. So can mom give the baby the virus? And we call that vertical transmission. There haven't been very many documented cases of that, so it's very rare. But we are looking at things like antibodies, and we're seeing that moms are able to give antibodies in the second trimester, as well as during breastfeeding, which is encouraging, although we don't know how long those antibodies are going to work for.
Right. Great. So yeah, I see you wanted to share some information with the general public. Is it okay to share that now?
Yeah, sure.
Okay. So I'm going to go ahead and share the data that very convincing data that you want us to look at. So you want to talk to this, please?
Yes. So if you look at the graph, you have the orange and the blue. The orange dot represents women who are pregnant with COVID-19, and then the blue are people who don't have COVID-19. And what you can see is in almost everything, so maternal mortality, meaning a woman dying from childbirth or in the period surrounding childbirth, there are more people who are dying if they have COVID-19. When we look at intensive care, there are significantly more women who need that as compared to those who don't have COVID-19. Preterm births as well is a significant difference. Many more women are going into preterm birth than those who are not pregnant. And then we look at stillbirths and neonatals. Thankfully, at present, it's not really too affected. However, when we're looking at preterm births, we really need to think about long-term outcomes. Preterm births are associated with a lot of problems for baby later on in life in terms of learning disabilities, sometimes failure to thrive, meaning they're not getting they're not able to grow in the same way as their counterparts. We don't know for sure because it's quite early for us to say what the long-term effects of preterm birth in these COVID babies will be, but it is something to be aware of.
Great. So that is something that is very informative because you see how the mom is not, there are certain issues that can actually affect the baby. So that is the reason why we're having this conversation because people are worried about what will happen to them if they got pregnant. And even we'll talk about the vaccines later, but they're also worried about, the antibodies. So the question I wanted to ask is, if the mom got the COVID, right, is she going to have antibodies that can be transferred to the baby? I know you mentioned something to that effect. Can you clarify a little bit?
Yeah, so there's been quite a few smaller studies looking at antibody transmission. We've seen that there is antibody transmission between mom and baby, usually in the second trimester. And that article just came out in Cell last month, that there's a reduced transmission or insufficient transmission of antibodies in the third trimester. But in the second trimester, we're seeing that there is transmission. Again, we don't know how long it's going to last, and we don't know if it's enough to really protect the baby from COVID-19. The other thing that we're looking at with antibodies is breastfeeding. So many women are going to have children in lockdown, and many women will then have their babies and be dealing with breastfeeding. So there are a lot of things to think about. If you have COVID-19, you've tested positive, you
Mhm.
definitely are encouraged to continue to breastfeed. And
Mhm.
there is a possibility that the antibodies are going to be transmitted through the breast milk, which there is scientific evidence at present showing that it's possible.
All right. Interesting. So let's just say, the mom has the baby and the mom gets the COVID, right? But the child hasn't. I'm trying to see how, you can breastfeed without giving the child the COVID.
Yeah, it's a very tricky matter. However, what women are encouraged to do is to continue expressing their breast milk, and to continue the same measures that you would if you were dealing with someone who is not, or if you're dealing with someone who does have it COVID-19. So that means wearing a mask,
Mhm.
6 feet apart from baby, if possible.
Mhm.
I mean, it's difficult though, isn't it? Because a new mom is going to want to be with her baby as
Right.
possible. So as long as she's washing her hands using alcohol-based antibacterial gel and wearing
Mhm.
a mask, it's definitely encouraged because the benefits outweigh the risk for
Right.
sure.
Right. 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 Well, so that leads me to another question, and I know people think that little babies can't die from COVID, and therefore, would it really matter if that child got it or not? Like, would it make any difference?
So we know that babies are doing relatively well if they
Mm.
do have COVID, but that there have been instances of babies who contract the virus and don't survive. So it is possible. However, it's a relatively smaller risk than an adult person.
Okay, okay, that's good. Now, so let's switch the gears a little bit, and now the vaccines are here, right? Um, and there's a lot of talk about how the vaccines were developed. There's so many conspiracy theories. One particular group of people, there's a pregnant population, were not included in the study, as you mentioned earlier on. So the question becomes, um, how are we going to navigate, vaccinating this special group of people? Because obviously there are some people who are already pregnant, those who want to plan to be pregnant. Can you please speak to this?
Yeah, I mean, I think it's difficult to say trust the science if you already maybe are a bit hesitant. However, looking at the theoretical risk of anything happening if you get the vaccination, there is no risk theoretically for it. So the American College of Obstetrics and Gynecology, the Royal College of Obstetrics and Gynecology coming from the UK, the World Health Organization, the CDC, all recommend getting the vaccine. We know that these are not live vaccines. We know that they are mRNA vaccines, which means they're not entering the nucleus, which is where our genetic code is. It's what sort of defines us. So we know that it cannot enter into the nucleus, and so it's not likely to change our genes. So it's as it stands, it is safe to give in pregnancy, and for people who are planning to become pregnant or people who are breastfeeding. The risk again far the benefits far outweigh the risks because, again, we've said that women are more likely to go to intensive care, go into preterm labor, have cesarean sections. Their babies are more likely to go to the neonatal unit. All of these things that have their own sets of complications have led all of these governing bodies to recommend getting the vaccination at any stage. Now, some people are recommending that if you are pregnant, to have the vaccination in your second trimester, because the third trimester is where we're seeing worse outcomes. So the idea is to build up your immunity as you're entering into your third trimester. And places like the UK are a little bit different than the States. In the States, they're saying for anyone who's eligible for the vaccination to get it. And in the UK, they're saying if you are high risk, so non-white, having previous comorbidities or any conditions of pregnancy like gestational diabetes, hypertension, preeclampsia, they're certainly recommending getting the vaccination then. But in the UK, they say if you're low risk, it's really up to you and your healthcare provider to have that discussion.
Nice, great discussion. So I'm enjoying this because, we've had a lot of questions about, pregnancy and the disease and even the vaccine and things like that. So I see that you sent us some information about, how pregnant women are able to pass on the antibodies that they have to their offsprings, right? Whether it's inside or through breast milk, like you mentioned. So the question I have is that what is the difference between the antibody that you get from maybe, let's say, the vaccine and the one that you get from the disease itself, right? Are both of them going to be transmissible? And again, I can add your slide so that you can help us understand this. Okay.
So ideally, yes. There have been a lot of studies now with pregnant women. I think over 30,000 pregnant women have had the vaccination. And so we have a little bit more data to work with. We're definitely seeing transmission of the antibodies from the vaccination through breast milk. I haven't yet seen any studies looking at the transmission of the vaccination antibodies through vertical transmission, mom to baby, when the baby's in utero. However, essentially the vaccine is creating an immune response. So there are many different antibodies in our body. We know that we have IgG, which means it's a sustained immune response. And we have IgM. IgM means that there's an acute infection going on. We know that in general, IgG is able to pass through the placenta and also through breast milk. And that is the sustained immune response, not the IgM, meaning active infection.
Okay, great. So basically, I mean, if I understand it, the immunoglobulins or whatever antibodies or the soldiers that are going to fight against the infection from the vaccine and then from the actual infection itself, not much difference. Is that what we're saying?
No, yeah, exactly. So the research has shown after the first dose, we're seeing transmission of these antibodies, which is really interesting, although it does wane in time. And then after that second dose, the immune system really, really gets excited and has more long-standing protection. And in terms of if a woman was to have the infection itself, I mean, we know that the antibodies are generally lasting about 3 months or so. So, I mean, when we're looking at the duration of how long these antibodies are going to work in baby, it's to be determined, but it's good to know that there is some transmission possible.
All right, great. So we've had some good discussion about this topic, and one thing that crosses my mind is, I mean, we know stillbirths and all of that, but can we say definitive that the COVID-19 can actually cause miscarriages?
I don't think we can say definitively that it's causing miscarriages, and in general, we've not seen that from the data so far. We can say that you are more likely to have a preterm birth. You're more likely to your baby ending up in neonatal care. You're more likely to require intensive care. And so all of those risks are very real. But in terms of stillbirths, thus far, we haven't seen that data.
All right. So I see that you gave us this information. How do we make sense out of this? This is a chart about, I believe, preterm delivery, how it actually affects. Yes, go ahead, please.
So basically, just looking at this, we're seeing that the majority of pregnancies are at term. So they're delivering over 37 weeks. However, we are definitely seeing an increase, as you can see in that 32. The one directly next to on the left, we're definitely seeing an increase in the percentage of babies who are requiring preterm birth as compared to previous non-COVID patients.
Oh, right. That's interesting information. So what it means is that, what is the take-home message to, people who want to get pregnant, right? During this time, should they hold off on it, or they should just go ahead and do it?
So I think the take home is vaccines, it's up to the individual. I'll definitely say that, and their healthcare provider. However, there is resounding information telling us that the theoretical risk is not there, and also the risk of not having the vaccination and then subjecting yourself to sort of chance of if you're going to get the severe symptoms, the benefits far outweigh the risks, and all of the governing bodies support people who are intending to get pregnant, who are pregnant, and who have recently been pregnant and are breastfeeding to get the vaccination. Save your life and the life of your baby.
All right, save your life and the life of the baby, as you heard it from our wonderful guest today. So we've been talking about COVID-19 in pregnancy, and we understand that there hasn't been a lot of data or a lot of information when it comes to this special group of patients. And therefore, people are unsure whether they should take the COVID vaccine and how they should, behave in terms of when they have the infection itself. We've understood from what she's told us so far that pregnant women tend not to do very well. There's been a lot of complications, even including, stillbirth and things of that nature. We therefore advocate that if you're pregnant and you're listening to us, you make sure that you mask up, you avoid crowds so you don't have the infection, because the outcomes sometimes can be bad. We also learned from her that you can actually pass the COVID antibodies that you generate to the baby, and in one way or the other, the baby might have some protection. We've learned a lot from her in terms of how this actually plays out between the mom and the baby. So yes, there's more data going on. There's more research going on when it comes to neonatal health in regards to COVID-19. And we're going to take a little short break. And when we come back, we're going to continue the conversation. We're going to look at what are the things that we need to do in order to protect ourselves, especially pregnant women. What are some of the complications that, although we've learned quite a bit about it, but then we want to delve a little bit into what can potentially go wrong if you have an untreated COVID-19 and you're pregnant, which I know will happen in some places like back home. It can happen. The testing is not that great. What are the implications it can have on the baby? And also we talk about the vaccine. Do we recommend it for pregnant women? I know she mentioned something about, talk to your doctor and all of that, but we're going to delve a little bit more into this conversation so that people will be more comfortable going into taking the vaccine. So please don't touch the dial. Send your feedback, send your questions through the comments section on Facebook. We're also live on YouTube as Healthinfoafrica. This is an organization that is trying to provide health information to people out there. We tend to bring this session every Saturday. So please don't touch the dial. We will be right back after this short break. So stay tuned.
It is the senior most community pharmacist, Dr. Tuli.
Tompo Asembeng.
Oh, no lie. Then I say if your driver can't pick you, I make you people give me lift go. Shackers inside now. I'm at say so on link copy. But
Tompo 11 p.m.
Oh, if it comes a seed in the who give me. I guess some entanglement before that side.
You know they hear social distancing, eh?
To leap from D, same crowd, the whole. As I be young in the Amazon, are they cool? If you no go pick me to catch them in small left.
See, this be the problem. Who tell you say corona affects youngins? If you know they care about your life, if a guy say NSW over 50 years, away get hypertension, way poppy to be diabetic. Charlie them their cold will mess them up.
You are go wear face shield.
And that changes anything? That thing they protect only your eyes.
Plus face mask.
Charlie, the youth will they take this thing for granted. It may not kill you, but if it give you long-term damage to vital organs like your lungs, if you go get for outside cargo house, they give your OGs where them die. Will you be able to fend for yourself?
Chama, so I can say because unless I start they do Yahoo enter Benino, na funeral cost me this The COVID itself make it left one at top. Who?
If people know they follow simple directions like social distancing, hand washing, wearing face mask and things, the COVID no go anywhere. And the way they make careless there, it be like you no go left with anytime soon.
So to say my shadow make beans eh?
If you love yourself and the people around you, they house and take your shadow go be cry.
You are here, you more like dog me. So they kill my vibe cry. Make I go get my FIFA.
And keep fighting with positivity.
All right, so welcome back, listeners. We are privileged to be bringing you today a very interesting topic, which is COVID-19 in pregnancy. Like we've been talking to Dr. Victoria Chamantin, and she's been giving us very interesting information about some of the things that we will have to know when we want to get pregnant or when you're pregnant, and what are the outcomes when you do contract COVID-19. So I'm going to bring her back on so we can continue the conversation about COVID-19 and pregnancy and how it actually affects individuals as such. So Dr. Chamantin, before we left, we were on the topic about vaccines, right? I wanted to know, potentially, can the COVID-19 vaccine have any, I would say, side effects or some sort of effects on your reproductive health, especially in females? Is it possible to do that?
It should affect. There's no reason to think that it should affect our reproductive health just because of the nature of the vaccine. It's not a live vaccine, right. And I think interestingly, when people ask about, is the vaccine going to affect me or anything, we don't know what COVID-19, the virus, is going to do, and but we do know that this protects us from the severe possible consequences of COVID-19 for anyone, which is always death. Death, long COVID, respiratory problems with your brain, blood clots. There are so many different things. So there's no theoretical risk in terms of fertility or a woman's reproductive system. And equally, we can't say that for sure, but we can't equally say the same with COVID-19, the actual virus.
Right. So that's the thing. The virus itself can potentially lead to death, but we do know that the vaccine hasn't caused any such side effects. So you get a better shot with the vaccine in this case. So then the biggest question in the room is, do we recommend pregnant women to vaccinate, right? When they get a chance to do so?
Well, I would say let's trust the people that provide guidelines for everything. If the World Health Organization is saying that it's safe to get the vaccination, and all of the governing bodies for reproductive health also, I certainly would agree with all of them and say that it is safe to get the vaccination.
All right. So that's you all heard it from Dr. Victoria Chamantin. She's talking about the fact that if you have the opportunity to do it, sure. There hasn't been any study that has definitively said it's comprehensive study that has been made, but you can talk to your doctor, and the recommendation is that you go with what CDC and all these organizations are talking about. Is there anything that you want to let our listeners know in particular?
Yeah, I would just say that pregnant women are a vulnerable population, which is why we haven't seen too many research studies with them. But in the time of COVID and in the time of the pandemic, it's really important to think about the big picture. Intimate partner violence has been up about 700%, according to some figures, and pregnant women are extremely vulnerable to that particular issue of intimate partner violence. So if you know someone who may be at risk, then it's important that you try and reach out to them and serve as a non-judgmental resource for them. I know it's difficult in places where maybe there isn't a shelter that a woman can go to, or there aren't services, but if you can just ask your friends or your, relatives or whomever you see that you feel is at risk. Are you okay? And things like that. It goes a long way, having a bit of empathy and being open with them.
Right. That's very interesting topic you just brought up. COVID-19 has brought a lot of things that we never thought about. So obviously, like you mentioned, vulnerable populations, pregnant women, and violence in that section is not something that we want to look down on. We want to make sure that we bring it to bear and people will pay attention to it. So very interesting and very good information that you're giving to our listeners. So let's wrap up this section of the show. Today's show is not going to be that long. We've talked about a very good topic, which is COVID-19 and pregnancy. Do you want to summarize everything for our listeners, and then we'll take your last words as we wrap up this section?
Yeah, sure. So we know that women who have COVID-19 and are pregnant are more likely to end up in intensive care, require ventilation, have preterm births, have increased C-sections. Their babies are more likely to go to neonatal intensive care as well. And in the end, the only thing we can do is protect ourselves. So the best treatment is prevention, making sure that you are socially distanced, making sure you're wearing a mask, washing your hands with soap and water or alcohol-based antibacterial gels, and you getting the vaccine. If you have access to the vaccine, I know it's very complicated and very difficult to get in some places, but if you have access to the vaccine, if it was me, I would absolutely get it, even if I was pregnant or breastfeeding. And hopefully we save your life and the life of babies as well.
Awesome. So yes, you all heard it from Dr. Tremantin. She's saying that make sure you protect yourself if you're pregnant. Even if the general population, the same information that goes out to the rest of everybody is the same protocols that we all have to follow so that we don't get the virus. So on behalf of HI, we would like to thank you for honoring this interview and giving us this insightful information about COVID-19 and pregnancy. And obviously, individuals who are out there who plan to get pregnant or get a vaccine whilst pregnant will feel more comfortable at this point to do so, or talk to their physician or their healthcare provider to be able to get that information. So thank you once again for coming, and we would like to see you one more time.
Thank you for having me. I do have a podcast for anyone who's interested. It's called Night Shift Delirium. It's available on everything, wherever you listen to podcasts. We just speak with a lot of junior doctors and learn about the world that surrounds them and how it informs their practice. And it gives a little bit of humanity behind the hero, if you will.
All right. Thank you very much. And again, we have some folks who came to see you on Facebook. We would like to highlight these people. So we have Charlie K. He said, Dr. A, must be you. I see you have a lot of good people coming on the show. So Charles says, I see you. Okay. We have Senna. Senna says, powerful presentation. Steve Tremantin, that might be somebody you related to. And we have Alexander says, great presentation. So people loved your presentation, which is good. We do have Alexandra. She says, thanks for bringing up the intimate partner violence in a pandemic. It is not talked about enough, especially on our part of the world. I think I understand. Even though we're about to let you go, this is something that she's sharing, that she really appreciates the fact that you brought that up. Do you have any last things to say about this?
I think it's something that we have to just keep in mind. I know that the resources aren't necessarily there in Ghana, but there are a lot of people who are at risk of intimate partner violence, both pregnant and non-pregnant. And in a time where we're encouraged to stay indoors and not be interacting with people that may have been as a resource to us, they're definitely at increased risk. So if there's someone you haven't heard from in a while, or maybe you might know something, there's nothing wrong in reaching out.
All right. Thank you very much, Dr. Tremantin. So it was great having you on the show.
Thank you for having me.
Thank you. All right. So thank you all for staying in today and listening to this very educative piece. We have the privilege of talking to Dr. Victoria Chomerton about COVID-19 and pregnancy. Pregnancy is pregnant women, basically a group of patients that, as we will call them, special group of patients that have different settings. And when it came to COVID-19, much wasn't known about what will happen when they got the virus, and also when they have the vaccine. Not much data was available. But as the time goes on, more information is becoming available, and we are going to benefit from when this data is released, making it more comfortable for people who are pregnant to be able to get the vaccine as well. So keep your comments coming in. The next section of the show, we're going to switch gears a little bit and go all the way to Cameroon in West Africa. So like I said, our show is supposed to get information and share it to everybody across the continent of Africa and even in other continents as well, such as the United States. So today we have the privilege of talking to someone who is all the way in Cameroon. She's a nurse. She's been researching on COVID-19. She has some good information to give us. Unfortunately, we might not be able to get her live feed in terms of video. So she's going to come on the show by audio, and we will try to bring her right after this break. But again, please share what this feed so that people will understand what is really going on with the pandemic. In terms of a little bit update from Ghana, yes, the vaccines are available now. Not to everybody. They only have 600,000 vials at this point, or doses. Ghana's vaccines are the ones from AstraZeneca. That is 2 doses, usually given about 8 weeks to almost 3 months, separating it. There is some good rationing going on in Ghana, where the vaccines are kind of distributed to places that are very endemic. There's been a lot of eyebrows raised about how the vaccines are distributed. Again, keep your comments coming in. What do you think about how vaccines are distributed in Ghana? And even if you are from another country or African country and you guys happen to have the vaccines, how is it distributed in these countries as well? We have troubles distributed in the United States. The last time I checked, almost only about 80% of the doses that are given or distributed are actually administered. So we have our own rollout problems in this side of the world. I'm imagining what will happen in Africa or in Ghana. So please keep your comment coming in if you think the way that vaccination distribution is going on in Ghana is appropriate or not. Again, like I said, we're going to take a short break, and when we come back, I'm going to bring our guest all the way from Cameroon to give us insight on what is happening in other parts of Africa, such as Cameroon. So please don't touch the dial. We'll be right back after this.
Madam, so then I watch for COVID.
I ain't mean this oh.
Unyi ni se o. I didn't know unyi ni se o.
Cause me who she.
Then I person
Then I person me who.
Then I person bibi sense na person ko.
Cause me put me no what so man na me who she.
All right, so welcome back. We're gonna try and get our next guest on the show. We're gonna be calling this person all the way from Cameroon, and she's gonna tell us about what is going on in Cameroon. So without much ado, I'm gonna invite our next guest, who is Mrs. Ase. She's gonna be our next. Yeah, hello, can you hear us? Hello? Yes. So I would like to talk about what is really going on in Ghana and the vaccination and how vaccines are being distributed. Before we go and get our guest from Cameroon, so we see a lot of celebrities getting vaccinated in Ghana, and is raising a lot of eyebrow about how vaccines are distributed. In my opinion, I think that maybe our healthcare professionals should be um, receiving the vaccine. They should be the ones that should get vaccinated. We should intensify the education of the vaccine. We should also make sure that people are clear. They should have more education. The public should be educated on what the vaccine is actually about, because we do have a lot of videos that we've collected from Ghana. And as you watched the little video that we played, the person who was interviewing him pretty much said that they don't think COVID is even real, left alone to think about the vaccine itself. People have a lot of conspiracies going on. So we're a little worried about how vaccination is going to be rolled out in Ghana. Let me try and take a little break when I try to get my next guest on the show, and I'll be right back.
It is the senior most community pharmacist, Dr. Tuli.
Tompo Asembeng.
Oh, no lie. Then I say if your driver can't pick you, I make you people give me lift go. Shark is inside now. I'm at to say it's on link copy. But
Tompo, 11 p.m.
oh, if it comes self a seed in the who give me, I guess some entanglement before that side.
You know they hear social distancing, eh?
To leap from D, same crowd, the whole. As I be young in the Emmas are they cool. If you no go pick me to catch him and small left.
See, this be the problem. Who tell you say corona affects youngins? If you know they care about your life, if a guy say NSL over 50 years, away get hypertension, way poppy to be diabetic. Charlie them their go mess them up.
You are go wear face shield.
And that changes anything? That thing they protect only your eyes.
Plus face mask.
Charlie, the youth will they take this thing for granted. It may not kill you, but if it give you long-term damage to vital organs like your lungs, if you go get for outside cargo house, they give your OGs where them die. Will you be able to fend for yourself?
Chama, so I can't say more. Because unless I start, they do Yahoo, I enter Benino, na funeral cost me this the COVID says make it left one at talk. Who?
If people know they follow simple directions like social distancing, hand washing, wearing face mask and things, the COVID no go anywhere. And the way they make careless there, it be like you no go left with anytime soon.
So to lazy my shadow make beans in.
If you love yourself and the people around you, they house and take your shadow go back cry.
You are here, you more like dog me. So they kill my cry.
But we for take responsibility and keep fighting with positivity. Never
Yeah, can you hear me? All right, so welcome back. We are trying to bring on our next guest, and we're having some technical difficulty all the way from Cameroon. But again, the conversation continues about COVID-19 vaccines. We're also going to talk about how vaccines are rolled out in Ghana, the distribution of vaccines in Ghana, and other parts of Africa. To be specific, when you look at the distribution in the United States and UK. Even though it was a little bit rough in the beginning, I think it picked up with time, right? So do we expect the same thing when it comes to vaccine rollout in Africa as well? What are some of the potential, hurdles that we have to cross when it comes to vaccine rollout in Ghana. So my understanding from what we're seeing is that there's very limited doses, right? We have only about 600,000 doses as of now, expecting more to come in as the time goes on. So the AstraZeneca vaccine that is going to Ghana was produced in India with a collaboration with the AstraZeneca company that collaborates with a company in India that are producing mass doses of the AstraZeneca vaccine. Even though it's not the same as what you see with Pfizer, it also offers a lot of protection, up to 70-something% in protection, which is pretty much good looking at our situation. And also the fact that you can store it at an ambient temperature or in the regular refrigerator as well. So this is going to be a massive vaccination effort that is going to be, done in Ghana. And we know that as time goes on, we will be able to, figure out the logistics in terms of whether we will be able to reach out to everybody, every part in Ghana, to be able to give these vaccines to them. But the question remains, even with the 600,000 doses that we've received, how is it being distributed? Is it going to the people that actually deserve it? Let me know what you think in the comment section as well, and let me know exactly what is going on in the grassroots in Ghana with the distribution. Is it given to people that are actually on the front, health workers who are on front line, or they're actually given to people that we think don't really need it? Are they given to people who are 65 years and older? How is the distribution going like in Ghana? And from what the information that we're gathering, it looks like there's not a fair distribution of the vaccine. The question becomes, when we have millions of doses, how is it going to go? Like we also have other countries. We're trying to get, our technical team is trying to get someone from Cameroon to give us an insight on what is going on in that part of the world as well. So we're going to try and pull the wires to see if we can get our next guest to give us a brief update from Cameroon. If we are successful, we will bring that session to you. Otherwise, we're going to wrap up the show in a very short time, and we'll go from there. So let me know from the comment section if you do have any questions regarding the COVID-19 vaccine in general, if you took it and how you felt as well. And we will be right back and continue this conversation. All right, so thank you guys for staying tuned today. We've been it's been very nice having everybody, listening to us, giving us all this information. We had Dr. Victoria Chamantin giving us very insightful information about COVID-19 and pregnancy. We tried to give you guys a second section all the way from Cameroon, but unfortunately, we're running into technical difficulty reaching our guest today. So this is all time will allow us today. Next week, we're going to have another informative section that will come our way on HIS. So please make sure that you subscribe to our YouTube channel. Also share this feed or this video. And until next week we meet, I will say that make sure that you protect yourself. You make sure that you don't go to crowd, you wear your mask, and you stay as safe as possible, and you don't contract the infection. So until next week, thank you very much for listening to us all the way from the studios of Healthinfoafrica. Thank you for.
It is the senior most community pharmacist, Dr. Tuli.
Tompo Asembeng.
Oh, no lie. Then I say if your driver can't pick you, I make you people give me lift go. Shark is inside now. I'm at to say it's on link copy. But
Tompo, 11 p.m.
Oh, if it comes in for CD, give me. I guess some entanglement before that side.
You know they hear social distancing, eh?
To leap from D, same crowd, the whole. As I be young in the Amas are they cool. If you no go pick me to catch him in small left.
See, this be the problem. Who tell you say it only affects youngins? If you know they care about your life, if a guy say